Hello, and welcome to today's session, Doc Talk for Teens. We collected questions from teens and pulled out 4 of the most common questions to answer today. I'd like to welcome 2 of my favorite pediatric rheumatologists to help us answer your questions today. We have first Dr. Peter Chira from Rady Children's Hospital in San Diego and Dr. Sampath Prahalad from Children's Healthcare of Atlanta in Atlanta, Georgia. So welcome to you both, and thank you so much for being here.
Glad to be here.
Thank you.
All right. And let's get started with question number 1. What is a fever? For example, even if you're sick with strep throat, I only get temperature of 99 or lower. What does that mean? And this question is for Dr. Peter Chira.
So, fever is just a sign that there's inflammation in the body, but there could be problems with the regulation of your temperature for other reasons as well. Usually it can be a sign for infection, but it could be part of your underlying disorder as well, as some disorders of JIA can have fevers with them. Typically, we don't get too concerned about fevers less than 99. Usually we're more concerned when the fever is 100.5 degrees Fahrenheit or 38 degrees Celsius, especially if you're on immunosuppressive agents. And the main concern that we have is trying to figure out whether your immune system needs to try to fight this infection or whatever's going on. So if you're on something like methotrexate or a biologic, we'll often tell you to hold the dose of your medication while you're recovering from the illness. There are times you can get a localized infection that could include like strep throat, an ear infection, or even a skin infection where you don't really get a fever that happens throughout your body because the inflammation is really localized. And so you may still end up going on antibiotics for something like that to recover from the illness. We're still going to recommend that you hold your medicine for about a week after getting that infection so you can recover from the illness. One thing that's going to be really important is if you're getting sick very often, we'll make adjustments with your medicines every once in a while to make sure your arthritis is under control, but that you're not always getting sick. After this year with COVID, we've been really lucky to learn that a lot of patients haven't gotten very sick. And that's just reminding us that we have to be really careful about wearing masks, especially around other people who may be sick, washing your hands, avoiding touching your face, things like that to keep you from getting germs on you. And for the most part, most people with arthritis and related disorders on immunosuppressants can handle a fever and can handle these different illnesses.
You're muted, Katie.
Thank you, Dr. Chair. Let's move on to question number 2. This is for Dr. Prahalad. Why does medicine wear off?
That is a great question, and I get it often. I think of this in 2 aspects. First of all, why does the medicine wear off, in a short term? So if I take the medicine this morning, why do I have to take it off tonight? Or sometimes it doesn't last for even a day or a week or so on. And this has to do with the fact that medicines have what is called a half-life. That means any medicine we take in our body clears it. And as the amount of medicine goes down in our body, then it doesn't work as well. And so you may get your arthritis symptoms or pain or rash or any of those things because there's not enough medicine in your body. So that's what I think of as medicine wearing off. So for this reason, different medicines have different frequencies by which we take them. Some you have to take it daily, like anakinra. Some you can take once a week, like methotrexate. Some you can take once every 2 weeks, like Humira. Or some you take every 8 weeks, like Ilaris, or so on. So each one varies depending on what disease you're treating and how long it lasts in your body before it goes away. The second part of why does medicine wear off, I hear is, why does the medicine stop working after it's been working great for the last year or 6 months or 2 years or something? And that's also, sort of wearing off. And what I think about this is there are a couple of different reasons. One is most of the time with children, they're growing. So your body weight changes and the amount of medicine that you get may no longer be enough. So unless we have been changing the medicine dose along with your growth, sometimes the medicine is no longer doing its job. And therefore, we may just need to go up on the dose, and that's all there is to it. And that's one reason for wearing off. The second reason for wearing off is in biological. So these are things like Chira and Remicade and things like that. Your body thinks of these proteins as foreign substances and you start fighting them off. So you make what are called antibodies, and these antibodies can make these medicines not be effective. And that happens especially the longer you've been on it. And if you have stopped taking the medicine for a while and then restarted, sometimes your body has developed antibodies to that. So for that reason, it's really important to stay on these medicines consistently and not kind of take them, more sporadically, randomly. And the third one is lots of times when you're taking any medicine, your body can develop some cells that are just resisting these kind of medication. That happens for every situation when we use medicines over a long term. So when this happens, sometimes you can go up on the dose. Sometimes you add a second medicine to help work better. And occasionally we just have to change and give a different medicine. But this also does unfortunately happen, but we do have better choices today. So we should be able to keep track of this. And no question is too simple. So when you see your doctor, make sure you ask these questions and learn more about your own arthritis and the medicines and so on, because that actually makes it much more empowering to control your own disease.
Great, thank you. And now question number 3 for Dr. Chira. What's best for stiff joints?
This is a really great question. I think part of the issue is just trying to figure out what is the context of having joint stiffness or muscle stiffness. And it's really common to have this sort of symptom with rheumatology disorders, especially with inflammatory arthritis. We actually don't know why it really happens, but it is a symptom that often will get better as the inflammation around the joint gets less active. And so you start feeling a lot better. Unfortunately, when the weather changes, often some people will complain about stiffness, or now during summertime with all the air conditioning that people are in, sometimes they'll get stiff even with air conditioning just because it's much cooler. Again, stiffness also can come out when you're doing a lot of activities, and so it may be more temporary when it comes back. So what's the best approach for dealing with this? So there's probably a few different things that you can do. One thing is primarily trying to deal with the scenario of why the stiffness is happening. So if it's first thing in the morning, you're a bit stiff because it's been cool overnight or what have you, one of the best things is actually warming the joint first thing in the morning. And that's where, sometimes I tell people, hey, get an electric blanket, put it on a timer and have it turn on maybe in about an hour before you're gonna get up. And that will help warm up those joints so you can actually get up out of bed a little bit easier. Another thing that's really helpful is taking a warm shower first thing in the morning. And some people end up taking showers a couple of times a day just because they have that stiffness happening. And it's really, really helpful to just warm up the joints because it's sort of like the stiffness is related to inactivity of the joints. One of the last things I do talk about doing is, potentially getting a warm pack to that area, especially if it's just one joint that's bothering you. And I'm sure a lot of you have done this little task before, but I've got a sock here. And what you can do is you can put something like rice inside the sock, tie it off so the rice doesn't fall out, okay? And then you microwave it for about a minute or so. And usually it'll keep the warmth. You can use other household foods as well. Sometimes beans are helpful, things like that. And you have a little warm pack that you can use at any time. But one of the most important things for stiffness is moving. And, this is one of the reasons why we discuss with you guys about doing physical therapy, doing those stretches that we keep saying, are you doing your stretches? And, other modalities that you can do would be like yoga or Pilates or other things in the morning. And so those are all, good measures when the stiffness is happening right then and there. Okay. What can happen is if the stiffness is happening more frequently, however, we're going to talk about whether you're going to need to go back on medicines again to help with the aches and pains. And often the short-term medicine that we suggest is going back on something like your ibuprofen or naproxen. And, initially we may say, hey, go back on scheduled dosing a couple of times a day just to see if that helps with that stiffness. And you can do that for a couple of weeks, and it actually can help you out with your stiffness if it's just really short term, especially the first few weeks of when the weather changes from fall, going from summer to fall to winter. A lot of times those changes can be really achy and painful, and you get more stiff. But if this is not really helping you and you're having it more frequently and you're trying to tell us, oh my God, it's now like not just 5 minutes each day, it's starting to happen like for an hour to 2 hours, and you actually say that there's some swelling going on, we may need to rediscuss, hey, do we need to do an adjustment with your medications? And a lot of times this is really important that you tell us that information, because we don't know what's going to happen to you on a day-to-day basis. Or your parents may notice that you're walking a little bit funny, but you're kind of like not wanting to change medicines. But sometimes a change in medicines, either escalating a dose or, adding something that could help keep you from having this stiffness or having a flare out like this, is going to be really important. And then we work on that. So hopefully that answers your question.
Thank you so much. And on to question 4. Our final question is for you, Dr. Prahalad. When I'm older, will there be more options for medicines?
I can say yes. And I know this because we have seen in the last couple of decades, lots and lots of new medications have been approved and developed for arthritis. And before my generation of pediatric rheumatologists, or the people who trained us, they had very little to offer. Most of the time they had exercises, steroids, and aspirin and naproxen, those kind of things. And they used to have gold shots, which were very painful and not sure if they really worked, at least for juvenile arthritis. And then when I was beginning my training and all, we primarily used methotrexate in addition to the steroids in the joints, as well as taking naproxen kind of medication much more. We stopped using aspirin to treat arthritis. But then over the last 20 years, we have had a whole 2 new classes of medications. One are the biologicals, and biologicals are essentially medicines that are made in the lab. They're synthesized in the lab. They're proteins, so they're huge molecules that you cannot take by mouth, that you have to give as either an injection or as an infusion, so where you go to an IV and get the medicine. And those have really made a huge difference. We do not anymore see children needing wheelchairs or crutches or walkers. They are running and playing and doing all the things normally. We are minimizing the number of kids that go on to have joint damage and even like physical therapy. We used to put splints on. We don't do that anymore. So that's been really good. And now we have so many of them and different classes of them. So the Humira and Enbrel, and those are Remicade, they're called the TNF inhibitors. There's interleukin-1 inhibitors, that's anakinra and Ilaris. And then we have IL-6 inhibitors, so like Actemra. So there are quite a few of these biological medications. And depending on the kind of arthritis you have and how long you've had it and what has worked and the situation, whether you can go get an IV or is it easy to get a shot? Are you a really little child who doesn't want to get shots? And so we use those kind of information to make the best decision. And then recently we have a new class of medications called the small molecules are JAK inhibitors. And these are pills that you take. The example is tafasitamab or Xeljanz. And these are pills you take twice a day. And that also seems to be very effective in controlling the disease. So all of these have happened. And then we do know of many, many other medications that are in the pipeline that have been developed. Many of them have been working in adults with rheumatoid arthritis. And generally, the way it works is they are tried first in rheumatoid arthritis. If it's safe and nothing happens to them, then only we will give it to our children because our kids are more precious. So we tend to have these, but so we do know there are quite a few medications already available for adults that we don't have for kids yet. And as you get older and you become an adult, there will be a lot more options available. So overall, it's very optimistic. And I think looking forward, we are able to control arthritis much, much better than when we used to in the bad old days. So now we are doing really well. So I think you have every reason to be hopeful and optimistic and have a normal life. And you may just start to take some medication for as long as you need it. And these medicines are also becoming easier and with less side effects and so on.
Thank you so much. And I just want to thank both of you so much today. And I feel like one main takeaway that we got from these answers is that as teens and kids, that you just shouldn't be afraid to ask these questions to your docs. Don't be afraid to really take time to talk to your docs and ask any kind of questions you have while you're on those visits with your docs. And again, thank you so much, Dr. Chira and Dr. Prahal. And we really appreciate your time today.
You're welcome.